Good morning, I am Dr. Hiba ZBIB. In this presentation, I will talk about infant incubator. It's a biomedical device which provides warmth, humidity, and oxygen all in a controlled environment as required by the newborn. Thermoregulation is the ability of an organism to keep its body temperature within certain boundaries, even when the surrounding temperature is very different. The temperature of the body is regulated by hypothalamus. If the temperature drops below 37 degrees, a variety of responses are initiated to conserve the heat in the body and to increase heat production. Heat production is due to metabolic activities. Premature newborns are unable to regulate their own temperature and are more susceptible to respiratory problems than full-term infants because their lungs may be unable to supply enough oxygen to meet elevated demands. The oxygen is utilized in the metabolic processes of the infant, and among these are the generation of heat to maintain body temperature. Incubator provides warmth and humidity all in a controlled environment as required by the newborn. A cardiorespiratory monitor keeps track of the baby's heartbeat and breathing. A pulse oximeter measures the level of oxygen in the body's blood through the skin. Blood pressure monitor measures the blood pressure using a small cuff placed around the patient's upper arm or leg. An intravenous line or IV is a catheter, a small flexible tube inserted into a vein. It's used to give the baby fluids, nutrition, and medications. Umbilical catheter is placed in the artery or vein at the stump of the umbilical cord. It is used to give the baby medications, fluids, and nutrition or to draw blood for lab tests. Because there are no pain nerves in the umbilical cord, putting the line in and maintaining it causes the baby no pain. Respirator or mechanical ventilator helps babies who cannot breathe on their own or who need help taking bigger breaths. Temperature probe is placed on the baby's skin with an adhesive patch. What is infant incubator? It is a biomedical device which provides warmth and humidity all in a controlled environment as required by the newborn. It's used mainly to keep a baby's core temperature stable at 37 degrees Celsius. Most incubators also humidify the air and can add extra oxygen. It aids in preventing infection and in stabilize the humidity of the child's environment. The function of an infant incubator: 1. Temperature control. 2. Oxygen concentration control. 3. Breathing gas filtration. 4. Humidity control. A neonatal incubator is a device consisting of a rigid box-like enclosures. The device may include 1. AC-powered heater, 2. Fan to circulate the warmed air, 3. Container for water to add humidity, 4. Control valve through which oxygen may be added, 5. Access ports for nursing care, and 6. a control system to help regulate incubator air temperature. The control system uses a temperature sensing thermistor which is taped to the child's abdomen. The thermistors are excellent solutions in applications requiring temperature measurement and compensation from -50 to 150 degrees Celsius. The thermistor was placed in one arm of a Wheatstone bridge. Temperature sensing with thermistors. The name thermistor is derived from thermally sensitive resistor, since the resistance of a thermistor varies as a function of temperature. Thermistors have a nonlinear relationship between temperature and resistance. Increasing the temperatures decreases the resistance of the thermistor. Advantages of thermistors: 1. High sensitivity to small temperature changes. 2. Temperature measurements become more stable with use. 3. Copper or nickel extension wires can be used. Disadvantage of thermistors: 1. Limited temperature range. 2. Fragile. And 3. Some initial accuracy drift. In the infant incubator, we measure air temperature between 32 and 38 degrees Celsius, baby skin temperature between 34 and 36 degrees Celsius, and total gas intake 35 liter per minute, and relative humidity 50 to 70%. Temperature-controlled air is passed through the chamber in which the baby is located to maintain it at a set temperature. The temperature in the air supply line varies a thermistor resistance that is compared with a fixed resistance that corresponds to the set temperature. If the temperature of the air entering the infant's chamber is lower than the set temperature, power is applied to the heater to correct for this difference. The amount of power applied to the heater is proportional to the difference between the actual air temperature and the set point. This means that the amount of power decreases as the temperature approaches the set point. Some incubators use the skin temperature of the infant, and the controller is set to maintain the infant's skin at a given temperature. A thermistor is a type of resistor whose resistance varies significantly with temperature. The control system uses the thermistor in a bridge circuit with the set point resistance as another arm of the bridge. When the temperature is equal the set temperature, air thermistor is equal air set point, bridge output equal to 0. When the temperature is not equal to the set temperature, the bridge output is amplified, giving the voltage V1 at the output, which is proportional to the difference in temperature between the thermistor and the set point. When V1 is bigger than V2, the control switch is closed and power is applied to the heater. V1 is compared with V2 generated by the sawtooth generator. Maximum V1 should be smaller than maximum V2. When V1 is bigger than V2, the comparator outputs a signal V3. V3 excites a gate pulse generator that outputs a signals V4. V4 allows the closing of the silicon-controlled switch and the production of the signal V5, then power is applied to the heater. Babies need to be kept in a controlled humidity environment. Low humidity may cause irritation on the throat and eyes and result in coughs. High humidity, on the other hand, may cause a runny nose and allergies. Doctors recommend keeping the humidity level in babies' room between 50 and 70%. Humidity transducer, conventional sensors, capacitive measurement technology. The capacitance of the capacitor changes with the humidity, which is measured by an onboard electronic circuit. The alarms in incubator are one airflow alarm, two high temperature alarm, three power failure alarm, and four set temperature alarm. A transport incubator is used when a sick or premature baby is moved from one hospital to another. It is similar to the infant incubator but is battery powered. Advantages: it provides the closest environment to that of the mother's uterus temperature at a uniform airflow, and the humidity can be controlled to the desired level. It protects the baby from all the disturbances and infection in the NICU. Disadvantages: since the baby lies in a closed hood, it is difficult to access the baby for medical procedure or care. In infant radiant warmer, the artificial heating is provided by a heating mechanism mounted overhead. The heating mechanism consists of radiant element, electric heating element, a heat reflector. Above this heater helps focus the radiant energy onto the mattress at the infant's location. The current through the heating element must be carefully controlled so that sufficient heat to maintain the infant's temperature is provided but overheating is avoided. A thermistor is placed on the exposed chest or abdomen of the infant to measure the skin surface temperature. Infant radiant warmer enable the clinical staff to observe the infant's condition. It carry out a special procedure, attach various therapeutic and monitoring devices. The infant is placed on a mattress under a radiant heating element. Low walls surround the mattress so that there is no risk of the infant falling off the device. The remainder of the area surrounding the infant is open to allow access to the patient. Advantage: allows physician and nurse to have easy access to the baby from all sides during the most critical period. Disadvantage: baby is open to all the disturbance and infection in the NICU, and it is difficult to control humidity.